Hey everyone, hello. It is time for Tuesdays with Tina. Happy to see you all. I'm going to take those glasses off. I normally come to you guys a little earlier in the day. My last patient of the day definitely ran a little late. So today with this Tuesdays with Tina, I'm going to be answering some of your frequently asked questions. So I posted something yesterday for those of you that follow on Facebook and Instagram. I posted something yesterday saying, send me your questions. Let me answer them. I want to know, and I'll answer them. So I did get a few questions submitted for that, but if you're watching live and you have a question that you want me to answer, you can ask me anything. It can be anesthesia related. It can be non-anesthesia related. So, of course, most of my questions were anesthesia related. So the very first question that I got, I thought was pretty cool, was what is my most favorite injection and why? And I love that question because there are so many wonderful injections that are available and out there. I will say that my most favorite injection is the AMSA injection, the anterior middle superior alveolar injection. And currently I put Mr. Skull away, but I will show you with this little tiny one, he's so cute and tiny. The AMSA injection, the reason why I love this injection so much is because for the maxilla, it's hard to get a lot of broad coverage with just one injection. It's really, really challenging. And the beautiful thing about that AMSA injection is it covers a broad space. So you will get the maxillary anterior teeth from the midline through the premolars, so you'll get the pulp of those teeth numb. You will also get the facial structures numb without getting the lip numb, and the palate numb as well. Pretty awesome to be able to get that much coverage with just one injection. Yes, it is a palatal approach. I know a lot of people do not like palatal injections, and there is a way to do palatal injections very safely and comfortably. You can go back onto the YouTube channel. I believe I talked about giving palatal injections on one of the previous episodes. I'll see if I can even pull that up, but the AMSA injection, my favorite, and that is one of the reasons why I love it so much. The other thing is, I think because it's one of the newer injections that we use in dentistry, it hasn't been around for a really long time. So I had to teach it to myself and master it on my own. And so I think that's the other reason why I really like it a lot, because I had to work so hard to learn it and become proficient at it, and then therefore also teach it. So there is that. That was one question. So I loved it. And again, if you have a question and you didn't have time to submit it to me, you can definitely put it in the chat and I will do my best to answer it now. So feel free, and I'll see if I can scroll through. So that was one question. What was my favorite injection? While the AMSA, the broad coverage. Another question was, what is the difference between a mental injection and an incisive injection? Aren't they the same? And the answer to that is yes and no. The mental and the incisive injection, they are the same, but they're different at the same time. So when you do that injection, there is a different ending process to it. When we're doing it, the approach to it is very, very similar, right? We're still palpating, feeling for that mental foramen, okay? And we are still pulling that lip out, getting a nice rounded vestibule here, like that, getting a nice rounded vestibule. And we are using a short needle, going 3 to 6 millimeters into the tissue, depositing the anesthetic. Depending upon your anesthetic type, it could be 1/3 to 1/2 of a cartridge. And when you do that, you'll see that anesthetic solution kind of bubble up. And you're like, okay, there we go. Cap your needle. The mental injection would end right there. And you would get really great, profound anesthesia of the lip. You would get profound anesthesia of some of the gingival tissue of the facial of the premolars to the midline of the mandible. But you will not achieve profound pulpal anesthesia. And if you're using articaine, you won't get let me rewind that. You won't get profound of pulpal anesthesia. Now, if you do the one step of massaging the anesthetic into the mental foramen, okay, now what you're doing is you're making that anesthetic solution go into the mandible, into the mandibular canal, where it can bathe the incisive nerve. And remember, the incisive nerve stays within inside the mandible. And when we do that, we get really great pulpal anesthesia of the premolars to the midline of the mandibular teeth on the side you're injected on. And if you use articaine with that particular injection, you may even achieve some lingual anesthesia as well. Okay, pretty cool. So the main difference between mental and incisive is all about what you do when you cap your needle. Your approach is the same, your deposition, your stabilization is exactly the same, but it's what you do when you cap it. If you want to get that incisive where you get great pulpal anesthesia, you're going to push and massage that anesthetic into the mental foramen. Okay, and remember, if you use articaine, you will get some of that lingual anesthesia as well. Now, remember, friends, if you have a question, please type it in the chat, because this is a free-for-all. Ask your question and I will answer it. And it can be on anything. It doesn't have to be on anesthesia. Okay. All right. The other question that I received is very, very specific to one particular region, and that is for Georgia. And I'm happy to answer that. What about hygienists in Georgia? What can they do? And hygienists in Georgia now can, because I don't live in Georgia, I do provide anesthesia certification training in Georgia. Hygienists in Georgia, as it states right now, can perform local anesthesia for their dental hygiene patients. Okay, that's what the Georgia board rules say, is for dental hygiene patients. So as of right now, there isn't any language in there about for any patients. It does say for dental hygiene patients age 18 and older. So that is where Georgia stands right now. If you live in Georgia and you and your office want to make sure that hygienists can also anesthetize for restorative patients, have the doctor that you work with reach out to the Georgia Board of Dentistry and advocate for that. Okay. All right. Okay. Somebody says, oh, the RDH injector. Hi, Katie. What is it about articaine that gives you lingual numbness? So I'm going to assume that has to go back to the previous comment that I made about why you might get lingual anesthesia with an incisive injection if you're using articaine. So I'm going to assume that that's what it is. So the beautiful thing about articaine is that it is a kind of a hybrid, right? We have hybrid vehicles where you have gas and electric. Articaine is kind of like a hybrid vehicle. It is in the amide family. It totally is an amide anesthetic, which is beautiful because then we have a reduced potential for allergies. That's one of the biggest reasons why we shifted from using ester-based injectable anesthetics towards amide-based injectable anesthetics was because of the I forgot the word, the prevalence of allergy with ester anesthetics. Okay, so articaine is kind of a hybrid. It's an amide anesthetic with the opportunity to have just the small little chemical alteration where it has I'm going to always, you guys, I teach this stuff and I have a hard time saying this, thiopene ring. I hope I said that right. Okay. So because it has just an alteration to that chemical formulation, it allows it to penetrate that thick cortical bone so much easier, which makes mandibular infiltrations a lot easier to do. It makes it so that when we do our maxillary injections that are especially palatal injections, if you pair articaine with any of your palatal injections, it's chef's kiss, match made in heaven. So that is one of the reasons why you might get more lingual numbness when you use articaine versus some of the other anesthetics, because of that chemical formulation that allows it to penetrate that thicker cortical bone. So yes, there we go. And then somebody says articaine spreads better than lidocaine. Exactly. And the reason why is because of that chemical formulation. You're very, very welcome. And thank you for asking a question. I love it because you guys, I love doing Tuesdays with Tina. I love it. I've been doing it for 4 years now. for 4 years. I come on here and do these sessions. And every once in a while, I love to do a free for all where you ask the questions that you want to know and I answer them, because most of the time I'm just sitting here going, I wonder what people want to hear about. What do they want to know about? Okay. All right. One more question that I received, and then I'm going to call it a night unless somebody pulls up another question that's burning, is why do I always miss my IA injection? And my friends, I could tell you, I get that question probably all day, every day. If I'm at a conference, that's the number one question, probably one of the number one questions that I get is, why do I always miss my IA injection? So my answer to that is, well, one, I need to watch what you're doing to be able to give you true feedback. If you're like, what am I doing wrong? Like, somebody's going to have to actually watch what you're doing to give you true feedback. With that said, usually what ends up happening is when somebody is missing their IA injection, meaning like the patient is not profoundly numb, the reason why is probably two things are the biggest mistakes that I see. Somebody has inserted too low, too close to the mandibular occlusal plane, not injecting high enough, right? When I go higher, kind of in line with the bite line, that's one reason. And or they are not appropriately next to the pterygomandibular raphe, right? That little rubber bandy ligament that goes from the maxilla to the mandible. So that will be another reason why. So you want to make sure you're nice and close to that pterygomandibular raphe and be about 10 millimeters above the mandibular occlusal plane, which also aligns with the bite line. And if you put your finger, your thumb, or your finger into the coronoid notch of the mandible, which is really hard to see on this little guy, but it's this little area right here. Okay, that little area, that coronoid notch, if you rest your finger right in that zone, that'll also help. Yes, someone just said angulation. Absolutely. Angulation with your mandibular blocks can be a big key to having a proper or improper mandibular injection. Okay, somebody just asked another question. For the IA, which anesthetic is best, lidocaine or articaine? Great question. That is a wonderful question. And I'm excited to answer this one because with all of these, I always say it depends. Okay, when you are choosing your anesthetic solution, the number one thing you want to be looking at is what is your patient's health history, and then what is the procedure that you're doing. Okay, all right, what kind of anesthesia are you looking for? Are you looking for long-term, profound, soft tissue and pulpal tissue anesthesia? Is this a routine type of a procedure where we want the patient to be numb for an hour and a half or so? So with that said, I will say, I am biased, maybe. I really like articaine. I think that articaine is a beautiful anesthetic drug. It was designed for dentistry in mind. All of our other anesthetics were designed for medicine, and then dentistry adopted. Articaine was designed for dentistry in mind, especially for our thick cortical bones. And now medicine has adopted the use of articaine. So in my opinion, articaine, with that said, identify your patient's health history. You have to understand what their capacities are to tolerate anesthetics. What is their capacity for vasoconstrictors? The other beautiful thing about articaine is that since it's metabolized in the blood in the pseudocholinesterase, it has less impact on some of the other internal organs like the liver and the kidneys, which is very appropriate for our patients now, especially we're seeing fatty liver disease on a rise within our culture. And it's not just our patients who have alcohol issues. We're seeing fatty liver disease in many, many of our patients who maybe have an unhealthy diet. So choosing an anesthetic that is not metabolized in the liver, doesn't pass through the liver as easily, is a nice option. So that would be one of the other reasons why I would probably have more of a preference towards articaine over lidocaine. Okay, great question. All right, let me see if there was another one before I call it out. Okay, so I thank you guys so much for your patience. I was late getting on here because I know I advertised 5:45. My last patient of the day requested me to be with her. She said that there was something about me that kept her calm and relaxed. And I said, well, then I'm glad I get to be here today. So you guys, I only work clinically one day a month. And so it's always a fun day. Oh, somebody asked, is the pterygomandibular raphe the inner or outer ligament? So what I'm going to do to answer that question is I'm going to post a picture in the next 24 hours of the pterygomandibular raphe. So keep your eyes peeled and I will show you a picture of that pterygomandibular raphe. But when you look inside your patient's mouth or even look in your own, you should be able to see it pretty easily. It's almost kind of like a little rubber band structure that you can see easily, and you can almost like you're going to play the harp on, go ding, 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 ding. It's kind of fun. I don't know. Maybe it's silly. All right. So keep your eyes open. I will show a picture of the pterygomandibular raphe in the next 24 hours within my Instagram and Facebook posts and or probably stories. Okay. The other thing is I'm going to have something new joining me tomorrow. And so if you're curious, you want to take a guess, what is happening in my life that will be new to me tomorrow? So stay tuned and find out. Ooh, wait a second. I see somebody pose a question here. No questions yet. Oh, okay. That was weird. I had somebody pose a question and now it disappeared. Okay. Friends, thank you so much. Thank you for asking questions and for being on here and being engaged and asking questions live as well. I really appreciate you guys being here, supporting me. And, oh, hold on. Hold on. Okay. Look what I picked up from the printer yesterday. Oh gosh, look it. Now the next step is this, you guys. This is just the resource guide. This isn't even the book. The book is a million times better than this chart that I've got here. So the next step now is for me to set up a way so you all can buy this. Okay, so that's another thing coming. I know, look at how beautiful and brand spanking new. A color pictogram chart as well. So I'm super excited for this. Is just a resource guide. And then the book will be, oh gosh, it's going through all the editing processes. So I'm super excited. So be prepared. That's coming your way. So I think I'm going to do a Shopify account. I don't know if anybody's ever sold material goods online and you know how to do it. Let me know. How do you do it? So anyways, in the meantime, if you want more anesthesia information, you can always reach out to me. You can go to teachertina.rdh.com and you can look at all of my on-demand online courses as well. And by the way, you can also see me Thursday night. I'm doing a CE course with CE Zoom. So let me know if I'll see you. And until next week, friends, I will see you then. And keep your eyes open for the thing that's going to be joining me tomorrow. I can't wait to hear what your guesses are. Who's joining me tomorrow? I'm really, really, really excited. Bye.